think now we go to the sphincters, especially the new adjustable VICTO sphincter. So I'm really excited that we have today the possibility to present you really brand new data of this new adjustable sphincter system, the VICTO sphincter. Professor Zachoval has already great experience with this new sphincter system, and he will share the experience with us. So,
thank you very much, Ricarda, for introducing me. And good evening, everybody. And I would like to share our first experience with the VICTO and VICTO Plus system in the Czech Republic. So by our study, we would like to evaluate both efficacy and safety of the treatment of the male stress urinary incontinence by means of adjustable artificial urinary sphincters VICTO and VICTO Plus as a new procedure implemented 2 years ago in the Czech Republic. We evaluated all patients implanted with VICTO or VICTO Plus system between December 2018 and May 2020. And the following parameters were evaluated before implantation and or after reaching the optimal continence status. It was the patient's history, efficacy, and the safety. The patient history means the age of the patient at the time of implantation, etiology of stress urinary incontinence, radiotherapy for prostate cancer, previous procedures for stress urinary incontinence, and other procedures in the lower urinary tract that might have been performed, and the follow-up time period from the implantation. The efficacy, we evaluated the volume in milliliters of filling fluid used for reaching the optimal performance status. And the objective tools were chosen according to the Saturn protocol, which we are part of. It is the EAU Research Foundation project. So we use the question number 5 from the ICIQ urinary incontinence questionnaire, where is the scale 0 to 10, and visual analog scale of the EQ 5D5L questionnaire, where is the scale 0 to 100. Also, we evaluated the parameters from the 24-hour pad weight test, the volume of the urine leakage, and number of the used pads. Just to remember, here is the ICIQ urinary incontinence short form questionnaire with the question number 5. Overall, how much does leaking urine interfere with your everyday life? 0 means not at all, and 10, it's a great deal. And here is the other tool, Euro Quality of Life group, with this visual analog scale from 0 to 100. And of course, we also evaluated all medical and surgical complications. Here is our results of our group of patients. We implanted 23 patients, 15, sorry, here is a mistake. That's 15 with VICTO Plus and 8 with VICTO. Average age of the patients was 65 years and average follow-up 9 months. The etiology of stress urinary incontinence was radical prostatectomy in 20 cases, open in 7 cases, laparoscopic in 4, and robot assisted in 9 cases. open prostatectomy, 1 case, TURP, 1 case, and a little bit peculiar etiology was proton therapy in 1 case also. Previous radiotherapy had 5 patients. Previous procedures for stress urinary incontinence, 2 patients. One of them had implanted artificial urinary sphincter over 3 years ago, and 1 patient, Argus tape, 6 years before the implantation of VICTO. Also, some patients has other previous procedures. We discussed it after the Professor Hübner's presentation. We also solve all the strictures in the urethra before we proceed to the implantation. So 5 patients had a transurethral bladder neck stricture incision and 1 patient optical urethrotomy. In 1 patient, we observed the first months after the implantation, technical failure of the device, leakage from the system. So this patient was excluded from the clinical evaluation, and we evaluated the rest 22 patients. The volume which we used for filling until the optimal performance status was reached was on average 8.7 milliliters with a range 5 to 15. Here is the evaluation by the questionnaires. The question number 5 of the ICIQ urinary incontinence questionnaire. Before the implantation, the average was 9.4 and after 3.8. So the overall improvement was on average 5.6 points. On the other questionnaire, visual analog scale, before the average was 32. The improvement, the status after the implantation was 79. So the overall improvement was by 47 points. Here are the results from the 24-hour bedded weight test. The volume of the urine leakage before the implantation was on average 722 milliliters and after 202 milliliters. So the overall improvement 520 milliliters, which means 72% decreased in leakage on average in all patients. The number of PETs used before the implantation was 4.5 on average and after 1.9, so the overall improvement 2.6. The safety evaluation, we observed no surgical or medical complication in none of our patients. So the conclusion from the first cases here in the Czech Republic are the treatment of the male stress urinary incontinence by means of adjustable artificial urinary sphincters VICTO and VICTO Plus is effective and safe in a short-term follow-up, and the efficacy of the treatment can be effectively improved by adjusting of the system. So, thank you very much for your attention.
Thank you very much, Roman, for sharing your experience with us. Maybe you can explain us a little bit more in detail what is the difference between the VICTO and the VICTO Plus, and the indications.
Yes, at the time of the implantations that we evaluated in this group of patients, we divided the patients according to the stress maneuvers. So when a patient was leaking the urine during the cough test and cannot interrupt the urinary stream, we use the VICTO Plus system. And in the other patients, we use the VICTO system. So we proceeded according to the instructions of these two systems. We changed strategy in the recent time. So now in most patients we use the VICTO system, and the VICTO Plus system we use only in patients where the VICTO system fails, or where there is a complicated operation feared, like a scarring tissue in the area. So the patients are pre-operated, and just in these complicated patients.
And do you have the feeling that with the VICTO Plus, the results, the continence rates are a little bit higher, or it's the same?
Actually, we don't have a sufficient number of patients to compare it statistically, but I didn't have the impression there is a much difference in the VICTO and the VICTO Plus system.
Okay. Vax, what is your experience?
Well, I don't see a difference in the continence result. And as Roman said, we are also a little bit stepping back from the VICTO Plus. I simply think that we don't need it very often. The need for me is in a case where there are several risk factors for erosion, and I want to, let's say, drive with an extra low pressure in the system, you know. So in these cases, I might use a VICTO Plus, because when the guy coughs, the tension on the urethra goes up, but then it goes back again, and the baseline tension or pressure in the cuff will be lower. So if it's a diabetic that has been irradiated and he has a low testosterone, then I might use the VICTO Plus. But I think these days we use 85%, maybe even 90%, the normal VICTO, because it works very well. And most of these patients are dry with the VICTO, and it's simply less material. We don't have 5 years experience or 6 years experience like we have with the AOS, with the AMS 800. But I could imagine that the more balloons you have, the more junctions you have, maybe technical failures might be a little bit higher in 3 or 4 years from now. So if I don't need it, I don't use it. And it is definitely not the way that I say, if a guy is leaking more, he gets the plus. This is not the correct approach to this question.
Thank you. So Tanja, we have a question, right?
Yes, we have now several ones. So we just start with the first one. You mentioned one case of technical failure in your patient cohort. What was the reason for this failure?
Yeah. So thank you for this question. It was the leakage from the system. We observe it clinically. We adjusted the system by filling a few times, but we didn't observe the improvement, and we observed by touching the system, by touching the port and the pump, that the system is still not very pressurized. So we concluded there must be a leakage from the system, although we couldn't prove it by an X-ray examination. So yeah.
All right.
This patient is waiting for the surgical revision, and we would like to change the system for a new one.
Okay. The next question is, I understand VICTO Plus has more pressure. Do you think it would cause more erosion? Perhaps you want to comment to this?
Actually, I'm not sure. Maybe Wax can discuss on it or comment on it more. But I'm not sure that in the VICTO Plus system there is much more pressure put on the urethra. I think these two systems are quite the same in this parameter.
Yes.
Yeah, they are the same.
The permanent pressure is the same in both because the pressure is defined by the pressure regulating balloon, and that is the same design in both implants. The VICTO Plus does raise the pressure, this is true, but only for the moment of abdominal pressure rise when the guy is coughing. But this is not that does not put the urethra at risk, I believe, because it's just a momentary rise of pressure.
Okay, the next question is, are number of pads useful? Which pads were used?
Yeah.
Mm-hmm. Which size? I think the question is which size of pads. Yeah.
Yeah.
Yeah. It is the problem with the evaluation of the patient, as we already mentioned in our previous presentations. When we evaluate the pad weight test before and after the procedure, we try to persuade patients to use the same pad so we can compare it. So the results are comparable. But it is true that many patients use the different pads after the procedure, smaller ones, pads with smaller capacity. So it is not very comparable. And the pad weight test in this concern, it is not very, very good. Yeah.
And the other problem is it's not only the pad itself, it's also the physical activity. If they have more physical activity after the implantation, that you can't really compare the results.
Exactly. Yeah.
It's again the problem.
Yes, many patients come back to their normal activities they're used to living before the radical prostatectomy and so on. So the activity is much bigger after the implantation and the adjustment.
Tanja, do we have another question?
Yes, we have 4 more to go. So the next one is, how many patients became social continent in your cohort?
Sorry, I couldn't hear the question, sorry.
How many patients became social continent if you have the results of this?
The social
continent, it means using one pad, just one pad. And we have, I have a table here open on the other screen. So we have 17 patients out of 22 evaluated that reached the social incontinence.
Social continence.
I also have to comment on this. We observed the difference in the efficacy before the first half of our group of patients that were implanted earlier compared to the patients that were implanted later. In the first patients, we proceeded really very, very carefully in terms of the risk of the trauma to the urethra. So when we were choosing the right size of the cuff for the urethra, and we have so it was somewhere in between. In the first cases, we choose for the larger cuff. So maybe that's why the efficacy in the first patient was not so high, but we observed actually no complications in our first patient. So in the later patients, or the patients implanted later, we used just the little bit more tight cuff than in the first group.
All right. Now
So that's why we observed better results in the later group of patients. Yeah.
This is correlating a little bit to the next question that we have, and this is: do you choose a tighter cuff for the VICTO? But then it would be for the AMS 800. Do you see there a difference?
Yes. Simply yes. If you're used to an AMS 800 and you have a certain routine in choosing the size of the cuff, we had the same experience like Roman. If you're in between two sizes with the VICTO, I take the smaller one, and with the AMS, I take the bigger one. And the interesting point also is, if you're doing AMS 800s for a while, you might know that you choose a size which you think is a perfect size, and it is a perfect size. However, closing the cuff needs a certain tension, okay? And the same thing, I don't know if there are different centimeters in the two implants or what the reason really is. But if you use a VICTO, it closes very easy. There's not very much tension. So as I said before, our routine is, if I'm in between two sizes, in the VICTO I take the smaller, in the AMS I take a bigger. Maybe it has something to do with the measure tape or anything like that. The VICTO always closes very easy.
All right. Then we have two questions left. The next one: what is the dry rate and the social continence rate for the VICTO? I don't know if you want to add something more. It's a little bit comparable to the question that we already had.
Mm-hmm. Yes, I think so. We already responded to this question.
Yeah, move forward to the next one. The last one, it's a more general one. Perhaps the other speakers can also give his experience or share their experience. Is the bulking agents have a role in post-radical prostatectomy incontinence?
I can give you a brief comment and answer. In my practice, no. In the guidelines, there is a place for very low level of incontinence. I have the feeling that most of the time it's used by some urologists within the first year of radical prostatectomy to help the patient wait a good moment for any other treatment for stress urinary incontinence. So for myself, it's no.
Same for me. We don't use it.
The same opinion.
The invasivity of the PROACT is very similar if we talk about invasivity. So I would prefer to put in a PROACT if I have a patient that would be an indication for bulking. I'd rather take a PROACT.
So Roman, and for you?
Yeah, I have the same opinion. Yeah.
Please say it again.
Should I say it again?
Yeah, please.
Yeah, I have the same opinion as Max and Emmanuel.
Yeah, I have the same opinion too. So I really stay on the EAU guidelines, and they recommend it in patient who want to have only
temporary
for the incontinence for some time, and normally my patients want to have to fix the problem and not a little bit improvement for a few months. So thank you very much to our presentators today, to the very excellent presentations and all the new data. What I learned today is, as every other implantation, we have learning curves in new implantations, and you already learned a lot for the new VICTO system. So with the experience you have now, I think additional studies would be very important to see the results with the VICTO system, with the perfect size of the cuff, with the experience you have with the adjustment. I think adjustability is one major issue and one major improvement in newer systems. And as we learned today in the questions we had earlier, it's not a demand for the patients because they want to improve their physical activities, but also in the doctors who want to have this chance to improve the results. So I think adjustability is really important in the systems. This is why we already had adjustable systems, and now the adjustable sphincters are also coming up. I think we really need comparable studies. We need really longer studies with longer follow-up to see what happens over the years. But I think this is a really nice device with a nice future. So thank you to everybody here today, also to the participants and all the questions you had. Thank you so much, and thank you very much to Promedon to give us the chance to discuss the really important topic of male stress incontinence this evening. Thank you so much.
Yeah, thank you also, Ricarda. I just want to add some last words as well. Thank you all for your time and the great presentations. It was really interesting, and so we had some starting problems with our auditory, but so at the end it was really a good discussions, also from the participants, and thank you very much.
Bye-bye, thank you.
Bye-bye, thank you for having
Thank you very much.
Bye-bye. Great. Bye-bye.
It was a pleasure.
Yeah. Hope to see you soon.
In person.
Yes.
Yes. Bye-bye.
Bye-bye.
Bye-bye.